We're here in Sacramento with Todd, and we're interviewing him. Todd's received treatment. And Todd, tell us first of all, are you a type 1 or type 2 diabetic?
Type 2.
And how long have you had diabetes?
Since 2000.
Since 2000. And tell us what kind of symptoms were you experiencing prior to receiving this treatment?
Experienced the diabetic retinopathy, which with a total loss of vision in the left eye. And that was back in the latter part of April of this year.
Okay, so in your left eye, now you had an ophthalmologist that was looking and examining your eye, is that correct?
Yes, they did complete testing and everything.
Okay, complete testing, and you lost your vision within a period of about a month?
Correct.
Okay, and so this is in March. You didn't receive this therapy until when? The end of May?
The end of May of this year.
Okay, and so when you came to this therapy and you're receiving this therapy, what were they telling you about your right eye?
The prognosis at that time was that the vision in the right eye would be totally reduced to zero, as in the left eye.
Okay, so the left eye took 1 month, so the prognosis was that within about 30 days you would be losing your sight in your right eye.
Correct.
And you would be completely blind.
Right.
Okay, so you started receiving this therapy at the end of May of this year.
Right.
Okay, and you've been receiving therapy for how many months now?
About
4 months, maybe?
Yeah, about 4 months.
Okay, so, and has that been on a weekly basis?
Yes.
Okay, so tell us what have you experienced since receiving this therapy from the standpoint of your right eye? Have you had any loss of vision during that time?
No, the vision is maintained 100%. 100%. The left eye is beginning to respond a little bit in that the tear ducts are actually working properly as they weren't previously.
So that's amazing. So the doctors told you that by this point in time you'd be blind.
Right.
And you received this therapy and you actually have maintained your sight in your right eye and you have some improvement in your left eye.
Yes.
Well, that's fantastic. That's great. Tell us a little bit other changes such as energy level, sleep patterns, anything else that's happening?
Energy levels are coming back to normal. They were way low prior to beginning the treatment. Yeah. And now they're beginning to get back to normal, where I can make it the entire day without just seeming like being hit by an 18-wheeler.
Oh, really? Yeah, great. Well, Todd, how do you feel? I think this is just wonderful news that you've not lost your sight in your right eye. I mean,
most definitely.
What's going on with your lifestyle? Are you feeling good about things these days?
Yeah, there's an excited anticipation of what's ahead yet.
Yeah,
so
that's great. There should be. Well, we have a lot of folks that'll be watching this, and what would you like to tell them just about your experience with this therapy?
Basically, if I hadn't had the introduction to this, life would be not near what it is right now. And I mean, I wouldn't encourage anybody, because there's aspects of the condition which work on the internal parts of the body that we don't see, and it repairs that and brings it back to where it should be. And I mean, what you see on the outside is one thing, but what you don't see on the inside is something totally different.
Great. Well, it sounds like in many ways you've got your life back.
Yep.
That's great. Well, thank you for interviewing with us today. We sure appreciate it, and we wish you the best as you continue your treatments.
Thank you.
All right.